Hello guys, this is Jonathan Munoz, and today I want to talk to you about my thoughts on emergency medicine for an IMG. So I'm gonna answer some questions I saw. One of them is emergency medicine friendly towards IMG? Yes, it is. It is, and it is friendly in different states, not in all states. It was considered a couple of years ago, like 6 years, 7 years ago, when I was in residency. It was considered one of those attractive careers or branches of medicine because it will allow to some laxity, to some I don't know, freedom on schedule, freedom on time, uh, with the counterpart that when you're working, you have to work super hard. So many people saw at that time that emergency medicine was attractive, and they will go all to emergency medicine. Now it's a great branch. I have nothing bad to say about emergency medicine. Like I don't have anything bad to say about any specialty. But I want to give you my thoughts on that. So it is friendly in some states. Again, you have to look at, for example, the ECFMG results for the last year and see which states matched the most IMGs into emergency medicine. And then apply to those states. Don't be dumb. Don't apply to states that didn't have any IMGs matching into emergency medicine. So apply it wise. Check the ECFMG report from the last year and then look at those states, apply there. Now, so that is the question. Is emergency medicine friendly to IMGs? Yes, some states only. What you need to apply to them is the same, about the same. You need a good personal statement, a good ERA CV, with the same idea as family practice and internal medicine of commitment to primary care, because emergency medicine in United States is the care that patients that don't have doctors, that don't have money to have a doctor, that just arrived to the country will receive the first. So, for example, I came from Mexico and I don't have any money and I don't have any care, but my diabetes is out of control. Who will see me first will be the emergency medicine doctor. This person will be the first one to try to diagnose me and give me treatment and then drive me to someone else. But at the beginning, or let's say I need a refill on my metformin and I don't have a primary care doctor and I don't want to go to a primary care doctor, I just go to emergency medicine. The emergency medicine, even if it's a waste of his, I don't know, intelligence, they will say, okay, take your metformin. Um, Emergency medicine, guys, has two levels in the United States. One is the urgent care side of emergency medicine, which is it can be done by a family practice doctor, it can be done by internal medicine, and emergency medicine doctors do it too as a side gig, um, because it has a lower level of intensity or severity of cases. You usually treat coughs, you usually treat back pains, sprains. You have to look at some chest X-rays, but nothing like intubations, vasopressor support therapy, big antibiotics. No, you're just using some simple things in a lower setting, like a clinic that has urgent care services. But true emergency medicine work happens at an emergency ward of a hospital. And so in those places, you will see a dedicated area for emergency medicine cases. Any patient that comes to the hospital has to go through emergency medicine for them to triage them, evaluate them, and then consider if they're going to do an admission. So, what is internal medicine? That part is mainly hospital work. The shifts, not in residency, I'm talking about post graduation. Internal medicine, emergency medicine is really hard for what I see. I remember I'm a hospitalist, I stay in the hospital all day, I talk and deal, and I'm friends with a lot of emergency medicine doctors. So we talk about their schedules, compare it with my schedule, compare it to what they do and what um, they would like to do. And unfortunately, it's late for me to be an emergency medicine doctor, and it's late for them to be a hospitalist. Each path, each branch has their pros and cons. So for them, for what I've seen, so many of them don't like their their schedule because as an emergency medicine doctor and depending on the scheduling on your team or the person that is hiring you to be an emergency medicine doctor in that hospital, your shifts could be in the morning, like from 6 to 1 p.m., or from 1 p.m. to 10 p.m., or from 10 p.m. to 3 a.m., and from 3 a.m. to 7 a.m. And from Monday to Tuesday, it could be from 6 a.m. to 2 p.m. From Wednesday through Friday, it could be 1 a.m. to 8 a.m. And the rest of the days could be 10 p.m. to 2 a.m. So one big thing that is not something tolerable for many after age 30, 35 is having a change in schedule because it messes you up to stay awake when you should be sleeping and to be sleeping when you should be awake and do this changing every 2 3 days. And also, yeah, they work 10 days a month. I work 14 days a month, they work 10 to 12 days a month, but their schedule is like this, crazy. And it may be, maybe you're able to tolerate that, but maybe not. So think about that. I would test it like right now. In if you're thinking about emergency medicine, I will test it this way. I will try to sleep for 3 days um, in the morning and to stay awake all night, and then 3 days try to sleep in the afternoon and stay awake all night, and then try to work or do something in the morning, and then the next 3 days try to um, sleep at night and work or stay awake all morning. You will see how your body suffers, and imagine doing this all your life. That's why so many emergency medicine doctors end up doing a fellowship. Like what? They can do palliative care medicine, and some emergency doctors become palliative care doctors. Why? Because they're looking for a change of pace. Now, also when you're an emergency medicine doctor, you during your shift, it's not that you just sit and relax. Emergency medicine doctors in a shift have to see at the very least, for what I've seen in the normal pace hospital, about 30 patients for which of them they have to write charts, they have to evaluate, and they have to derive to the care that they need. So 30 charts is a lot. I do 15, 16 charts a day, and I'm suffering. Imagine 30 charts. So they're used to that, but it's a lot. They don't have time to properly sit and eat lunch, properly, I don't know, find time to go to the restroom, to drink water. They have to do it all in the go. They will have to, you will see them eating on their table or their desk while charting. And to me, I don't know, it sounds a little too fast. It sounds a life that is too fast. The pros is that they work 10 shifts, 12 shifts out of a month. They make more money than internal medicine or family practice. We're talking about $50,000 more, and that's about it. That's about to me. That's about it. They do a lot of procedures. And part of their work in the emergency department is to do procedures. We're talking about intubation, thoracentesis, paracentesis, but most of the procedures nowadays are derived to the interventional radiologist. Procedures that are still done by the emergency physician are intubations or central lines, Um, but a lot of things that the emergency physician has to do nowadays is coordination of care. If there's a patient with intracranial bleed, call the neurosurgeon. If there's a patient with a GA bleeding, call the gastroenterologist. Or if there's a patient going to be admitted, call the hospitalist. So it's a great career, and you have that personality, and you could tolerate that pace all of your life, even when you're older. Then go for it. I see. You know, one thing that's true to me, I haven't seen an emergency physician that is more than 60 or 65 years old. And I know one or two, but I haven't seen many in all the hospitals I work. In all the hospitals I work, I see emergency physicians that are young. And I'm talking young all the way to, I don't know, 55, maybe 55 top, because it seems like an exhausting specialty. Um, and so I would say it is friendly. You have chances as an AMG, um, but the you may have not considered the pace, and you may not have considered the how difficult it could be to tolerate a life like that. But many do it, many like it. But I'm pretty sure that many that are in emergency medicine are looking at the alternatives that they can work when they are not able to continue tolerating the life of an emergency medicine doctor. So that's it for my advice on emergency medicine. I think it's a great career, great opportunity. So if you can do it, go for it. But just make sure you took in consideration my opinion on this. Yeah, if it can help you at all, especially if you really want to have a family and you want to have the life balance, life work balance. I think it's a good one, but it comes with the working crazy hours and changing that constantly. So go for it if you really are into emergency medicine. It's a great career.